Bisoprolol side effects. Bisoprolol, a beta blocker commonly prescribed to manage various cardiovascular conditions, exhibits a range of therapeutic effects. However, like any medication, it is crucial for patients and healthcare professionals to be aware of potential side effects associated with its use. One of the primary purposes of bisoprolol is to reduce blood pressure and relieve strain on the heart by blocking the effects of stress hormones like adrenaline. While this can be highly beneficial for individuals with conditions such as hypertension or heart failure, it is important to recognize and monitor potential side effects that may arise. Common side effects of bisoprolol include fatigue, dizziness, and a slower heart rate. These effects are often mild and transient, particularly when the body adjusts to the medication. It is not uncommon for patients to experience these symptoms initially, but they tend to diminish over time. A more serious but less frequent side effect is hypotension or low blood pressure. Individuals taking bisoprolol should be cautious when standing up, especially after periods of rest, to avoid dizziness or fainting. If persistent low blood pressure occurs, a healthcare professional should be consulted to assess the appropriateness of the dosage. Additionally, beta blockers like bisoprolol may cause changes in blood glucose levels, particularly in individuals with diabetes. It's important for diabetic patients to monitor their blood sugar regularly and communicate any significant fluctuations to their healthcare provider for appropriate management. While bisoprolol is generally well tolerated, some individuals may experience adverse reactions related to the respiratory system. Bronchospasm, characterized by wheezing or difficulty breathing, may occur, particularly in patients with pre-existing respiratory conditions such as asthma or chronic obstructive pulmonary disease, COPD. If these symptoms manifest, immediate medical attention is essential. Bisoprolol's impact on lipid metabolism is another aspect to consider. It may lead to alterations in cholesterol and triglyceride levels, though the clinical significance of these changes is a subject of ongoing research and discussion. Regular monitoring of lipid profiles is advisable, especially in patients with existing lipid disorders. Moreover, beta blockers, including bisoprolol, may affect mental alertness and cognitive function. Some individuals may report vivid dreams, difficulty concentrating, or mood changes. While these effects are generally mild, patients should communicate any concerns to their healthcare provider for appropriate guidance. It is crucial for individuals taking bisoprolol to inform their healthcare provider of any pre-existing medical conditions, ongoing treatments, or allergies. Certain medical conditions, such as heart conduction disorders or severe bradycardia, slow heart rate, may warrant caution or alternative treatment options. In conclusion, bisoprolol is an effective medication for managing cardiovascular conditions, but it is not without potential side effects. Regular communication between patients and healthcare providers is essential to monitor and manage any adverse reactions effectively. Patients should be proactive in reporting changes in symptoms or any concerns, and healthcare professionals should conduct regular assessments to ensure the medication's continued safety and efficacy for each individual patient.